All right, so today's topic that we're going to go through is this concept of centralizing pain that we will see in the McKenzie world. So if you've been in our office and you've had sciatica or pain that's been going down your arm, or if you've been in another office in your previous life of sciatica, you might have heard this concept of centralizing pain. So let's define centralizing pain. What is it? I think the easiest way of describing it is just to draw it. So I drew a little stick figure or a little leg. These are legs here. Let's draw sciatica. So here you've got this pain that's running down your leg, let's say to the middle part of your calf, right there, okay? The concept of centralizing pain says, hey, we're gonna move you in a position, maybe it starts doing our back bends, or maybe we're up on the wall doing side glides or press ups on the table. Whatever the motion is that we are doing, we are looking for the pain to come up to the center of the body, hence centralizing pain. Why is this so important? Statistically, 75% or so of patients that start to see this concept of centralizing pain with care have great outcomes down the road. And obviously one of our biggest goals are the best outcomes possible down the road. So why do we want to talk about this centralizing pain? Well, one, because again, it gives us good information about what our outcomes are going to be down the road if we're seeing a positive centralization sign. The other thing that is the more confusing thing is just because the pain is centralizing, coming up, doesn't mean that it's less intense. Sometimes it can even be more intense. So I like to look at this picture in the McKenzie book, this Treat Your Own Back book. It shows that there's this dense red here and going down. This is sciatica, okay? So as the pain starts, you'll see it's like a progression this way of centralizing pain. This would be bad, this is good. The lighter the red is probably less symptoms. So as the pain starts coming up, it might start to intensify in the back. And you might ask why. We don't exactly know why. There's a lot of theories out there why. The way that we like to explain it to patients that seems to make the most sense is if you have this much pain and we're taking it and smushing it into this much pain, it's taking this much, pushing into here and concentrating it. That's the easiest way to think about it. So that's the concept of centralizing pain. So again, why we wanted to talk about this is this does not mean less low back pain. It might actually be more intense low back pain. That doesn't mean that you stop doing what we're doing because it's probably working. Obviously, we want to know about it. If it's not working, we can kind of reassess it. But if we're getting centralizing pain, pain's coming out of your legs are getting stronger, you're walking better, but this is intensifying, it's okay. It's not a setback. We are actually looking for that to happen because we know that 75% of people who have that, the outcomes are great down the road. So again, today's little topic, centralizing pain, one of the most common things that we see in the office. Good prognosis if we're starting to see it happen. But again, don't be upset and don't fear this concept of this starting to intensify low back pain, because there's a lot more that we're going to do that's going to make that go away with other things in our office, adjustments, DNS concepts, massage therapy, cupping, acupuncture. We'll get that low back pain to go away for you, or with you, I should say. All right, so that's